This is a very short lecture to introduce the key theme for this semester of walking with pathology. The idea is to give you an idea of what it is we'll be looking for when we're assessing your work, giving you some focus on what we hope you will achieve this semester. What we really want to do is give you a bit of space to think about how your patients walk. Most clinicians have extremely busy lives with a very short amount of time to see any individual patient. They've got very little time to step back from it all and think about what it is they're doing and why they're doing it. In 4 of the teaching sessions this semester, we want to give you an opportunity to think about just that. Why is it that your patients walk the way they do? And how can clinical gait analysis be used to help them walk more easily? This is how we've formally described the aim of the module: to challenge students to explore the conventional understanding of why their patients walk the way they do, and through this develop an advanced and systematic understanding of walking with pathology. There are 6 weeks here that we're talking about. This week the subject is going to be looking at the underlying pathology that affects our patients. Next week we're going to look a bit more specifically about how that pathology affects the way they walk. There's then going to be a little bit of a break, and on the 1st of December we're going to start looking at clinical interventions. How do we provide treatments to our patients to assist them? And then the week after that we'll think more specifically about what is the role of clinical gait analysis in relation to those interventions. As well as the taught weeks, there are at least 2 other weeks that are labelled as assessment preparation, when we will be expecting you to study privately and direct your own studies in pursuit of the assignment we're giving you. So just to go over the formal learning objectives for the whole semester and look at those that are particularly relevant to these lectures. The second learning objective is to analyse how neuromusculoskeletal impairments affect walking in patients with at least 2 conditions. One of those conditions is going to be cerebral palsy, and most of the formal teaching we deliver will use cerebral palsy as an example. And the other condition is going to be one that you select as a basis for your study this semester, and which will lead to a specific assignment that you should submit at the end of the semester. The third learning objective is to hypothesize how clinical interventions might be expected to improve these. Then there's also a 4th and more general learning objective for the module: to identify and critically evaluate research and advanced scholarship. And throughout this model we really want you to think about the evidence base for your practice. What is that evidence base? Where does the evidence come from? How much of what we do is based on what we really know, and how much only on what we think we know? This is the relevant assessment I've been talking about, Assessment 1. You should by now have glanced through that to orientate yourself as to what is required. Although the title focuses on clinical gait analysis, we want you to use this as an opportunity to demonstrate what you know about the broader aspects of the condition you're choosing to focus on. As with much of the programme, you'll get credit for showing an in-depth knowledge of specific aspects of the condition, rather than the broad general knowledge. And in order to convey this within the word limit, you might have to focus on specific issues that you would like to discuss. We also want you to demonstrate where your knowledge comes from, and that you understand the boundaries of that knowledge. If you spend your time wisely, you should be able to work on your assessment week by week, so by the time you've finished week 4, you've got a clear idea of what is required to finish off your assignment in the 2 further preparation weeks. We want you to think about walking with pathology by asking 4 questions, 1 for each of the weeks that we showed on the earlier slide. The first question is, what is the underlying pathology and what causes it? This is the question we're going to ask this week. Before moving on to think about how the condition affects walking and motor function, we just want to pause and place the mobility issues in the context of the condition as a whole. What causes the condition? How many people does it affect? How does the condition progress over time? What is the burden of disease on the individual? What is the patient's perspective of what is wrong, and how might this differ from the clinician's perspective? Having established that this week, then next week we'll look much more specifically about how the condition affects walking. Later on in December, we'll ask what options the clinician has to help improve walking ability. And in the final week, we'll think more specifically about how gait analysis can be used as part of the broader picture of clinical management. What is important at master's level is that you internalize your knowledge. You need to turn it from something that you read in a book or off a website to something that's useful in your everyday practice. Perhaps the best test of whether you've internalized knowledge is for you to teach others about it. In most of the weeks, there'll be an opportunity for you to give some sort of short presentation about what you've learnt to the others in the group. Please make use of this invitation, as it will probably be the most valuable learning experience of your week. More generally, whenever you're writing, try and make your principal aim to make whatever you're writing about as clear as possible to the reader. The first step towards this is making sure that you understand the material yourself. Always reread what you have written. If you can't follow the flow of your own arguments, then you can be fairly sure that your reader won't be able to either. Part of the process of internalization is in using words that you are happy with and understand. Many of the papers and textbooks that you'll be reading as sources are written in highly technical language, sometimes language with which you may be unfamiliar. Try and translate this into language which you do understand and are familiar with. Only use technical terms when there's a particularly good reason to, a particularly specific point that you want to make. Never use words that you don't understand. And where you do use technical terms, use them accurately. One of the worst faults in writing for an assessment by someone else, like the assessments you'll be completing as part of this module's work, is to use technical terms incorrectly. Failure to do this really undermines the confidence that the assessor has in your work and makes it much harder to convince him or her that you know what you're talking about. If you are uncertain if you're using correct language or not, then try and find alternative words that you do understand and know are correct. Real-world knowledge is rarely complete, and part of the internalization process is to be able to act sensibly and professionally on the basis of incomplete knowledge. There are two very common problems. The first one is partial knowledge. Very often the answer to a specific question we want to ask isn't known. The best we can do is uncover the answers to related questions and use some reasoning process to deduce the best possible answer to the question we really want to ask. This requires a skill called synthesis. You have to take evidence from a range of sources and make a balanced judgment in order to answer a specific question. The second problem is contradictory knowledge. It's not at all uncommon in our field to find that different sources give different answers to the same or at least very similar questions. This occurs most commonly when the answers are based on opinion, but it can also occur with research, because no two research projects are conducted in exactly the same way, and all of them have significant limitations. This requires another skill, evaluation, the process of weighing up the strengths and weaknesses of the different pieces of evidence, and again, making a balanced judgment. Synthesis and evaluation are key words because they are what we'll be looking for when we mark your assessment. It's worth reflecting on the different sources of knowledge. How do we know what we know? All modern health professions have gone through some sort of formal tertiary education. This generally involves formal teaching delivered by qualified teachers. Those qualified teachers should have a good understanding of the evidence base, and their teaching should generally be reliable. University teachers now undertake considerable training themselves to assure the quality of how they teach. Having said this, that teaching is at a fairly low level, and may have been oversimplified to make it appropriate for that level. It tends to be about general principles which might not apply in a particular situation. Perhaps most importantly for most of it, it happened a long time ago, and our memories can be inaccurate. Most of us, through the course of our careers, have been exposed to less formal, on-the-job teaching, often by senior colleagues. This is often more advanced and more applied to a particular situation. On the other hand, those colleagues are generally not qualified teachers, and may not themselves have as full an understanding of the evidence base as they could have. They may be unduly influenced by particular schools of thought rather than formal evidence. Their teaching is extremely valuable, but it needs to be continually reassessed by you in the light of the other sources of knowledge of which you are growing to be aware. We also learn from our own personal experience. In many areas, it's not until we do things and reflect on what happens that we fully internalize our knowledge. Learning from mistakes, of course, can be particularly important. The main risk here is of overgeneralization from a specific incident. To protect against this, we need to compare our experiences with those of other people, both informally by chatting with colleagues and formally by comparing with the outcomes of formal research. We also learn, of course, from reading. In many respects, scientific papers are the purest source of knowledge. They describe the results of specific experiments. But even so, they do have limitations. Clinical research tends to be done in idealized conditions to answer very specific questions. Our clinical practice often spans far wider boundaries and is rarely ideal in any way. It can be exceedingly difficult to judge how well the research has actually been performed, and we often have to rely heavily on the honesty of researchers in having done what they said they've done. Many clinical researchers have preconceptions about what they expect to find, and this might influence how they interpret the results. Perhaps the biggest issue here is that many trial results are simply not published. This is a particular issue when research does not produce the expected result, and especially if the result is that the treatment hasn't worked. There is thus a bias in the literature's research that has given positive results in line with the researcher's original preconceptions. Over the last decade or so, systematic reviews have become increasingly common. These attempt a systematic analysis of all previous published studies. This can't, of course, correct the bias arising from research that hasn't been published for one reason or another. In the best of these systematic reviews, the quality of the studies is assessed, and a synthesis of the highest quality research allows a specific question to be answered. Systematic reviews are regarded generally nowadays as the most authoritative source of knowledge that we have available. They themselves, of course, have limitations. They still generally only answer very specific questions, and the information provided from this can sometimes be misleading. A recent systematic review of the effect of orthoses on the gait of people with stroke, for example, included all the studies that had been found and came out with the conclusion that orthoses don't work. If you look at the underlying data, however, it's clear that if orthoses are used in specific conditions, that they can bring about considerable benefits. The best textbooks aim to present a synthesis of current knowledge and will provide references back to specific studies or systematic reviews. They will present knowledge in a coherent and systematic structure which can often support generalization beyond the specific findings of individual studies or the specific questions asked by specific systematic reviews. You should always remember, however, that a textbook generally affects the opinion of one person or a small group of people, and that there will inevitably be biases in what is written. You need to be aware of these potential biases. You should be particularly cautious with paragraphs that aren't appropriately referenced, where the author may be substituting his or her own opinion in the place of real evidence. If you are particularly interested in a specific issue, you really should check at least some of the references to ensure that they actually say what the authors claim they say. Be particularly cautious with commissioned reports. It isn't at all uncommon to find what looks like useful knowledge in a report commissioned by a charity or a professional group or perhaps a commercial company like a drugs company. Be aware that these will almost always have been written from a particular perspective and may be selective in the use of evidence. I know of a particular report into the financial burden of a particular condition written by a respected accountancy company which is widely cited, but is clearly a worst-case scenario. Of course it is. It was commissioned by a charity campaigning for financial support from the government for people with that condition. By all means read the reports and use the information they contain, but do so critically and always check the facts. Then, of course, there is the web. I suspect the biggest problem with the web is that we are too cynical. My general impression of researching things that I know about on the web is that the information is generally very reliable. One of the advantages of web searching is that it's possible to come across multiple sources of information very quickly, and consensus amongst these may well indicate reliability. Do watch out, however, for different sites using the same underlying sources. From an academic point of view, and particularly writing assessments, the web is a very good starting point. But unless you restrict yourself to the official sites of really respected organisations, you should always look for more formal verification of what you have read there. So just to summarise, this semester we want you to really think in some depth about what you know about the clinical conditions of the people you treat, and to consider how they might benefit from gait analysis. We want you to do this by considering the evidence base. We want you to understand the limitations of that evidence base. We want you to synthesize knowledge where the evidence base is partial and evaluate knowledge where it's contradictory. Above all, we want you to internalize the knowledge and use it as a foundation for your clinical practice. If you provide evidence of this, then we'll be able to agree that you are working at master's level.